Dr. Sarada Pasangulapati. I'm a gastroenterologist at Yashoda Hospitals, Somajinga. Today we are going to talk about abnormal liver function tests, abnormal SGPT, SGOT levels in pregnancy. This is one of the commonly asked questions by pregnant mothers, and this is one of the commonest reasons for referral to the gastroenterologist by the gynecologist. Abnormal liver function tests can occur because of pre-existing liver problem which happens to be diagnosed in pregnancy, or due to conditions which would occur in an otherwise non-pregnant woman and happen during pregnancy. And finally, there can be very specific problems related to pregnancy itself. So first of all, we'll talk about the common ones. So viral infections like hepatitis or dengue fever or malaria. So these infections can affect the liver. So they can be seen as very high levels of SGOT, SGPT in the liver. The more commoner ones which give rise to very low levels of SGPT, SGOT are fatty liver disease or hormone-related or drug-induced liver injuries. Any drugs can sometimes affect the liver, and we correlate this by elevation in the liver tests, which tend to occur along with the beginning of the drug. And the tests tend to improve when we stop the drug. That's how we come to the diagnosis of drug-induced liver problems. The third category is pregnancy-specific liver diseases. So thankfully, because of screening in pregnancy, we tend to pick up conditions like hepatitis B and hepatitis C along with HIV in pregnancy. So this provides us a very good opportunity to screen pregnant women and treat these diseases either during pregnancy or after delivery. The conditions which are also very specific to pregnancy can be very mild to very serious liver problems as well. The very mild ones are usually because of hyperemesis, wherein mothers vomit a lot. So that can cause high levels of liver enzymes. This usually tends to settle after the first 3 months of pregnancy and with simple medications. The more serious liver problems that occur tend to usually occur in the last 3 months of pregnancy. They're called either HELP syndrome or AFLP. These are very advanced liver problems, and sometimes these conditions only improve after delivery of the baby, and sometimes we have to resort to an emergency cesarean section to treat these conditions. Sometimes the liver failure can progress even after delivery of the baby, and in rare circumstances a liver transplant might also be required. So how can these be diagnosed? By simple liver function tests and an ultrasound scan of the tummy. And how can they be prevented? Not every liver problem can be prevented, but most liver problems can be prevented in pregnancy by healthy diet and not gaining excessive amounts of weight. We tend to see that now mothers are older as well as overweight, and this extra weight tends to impact on the liver and causes fatty liver disease, which is now a very frequent occurrence in pregnancy. So healthy eating, adequate amount of exercise, and the final one is prevention with vaccinations, especially hepatitis B. Ideally, every woman, be pregnant or non-pregnant, should be tested for hepatitis B and be vaccinated against hepatitis B, and there is a very safe and effective vaccine for this. Thank you very much.
Like, comment, and subscribe for more health updates.